process going. Okie doke. I'm still waiting for the voice to tell me. And she's not talking to me. Oh, it says it's recording now. Okay, very good. I think, do I have anything else to say? If you are attending this as more than one person, it simply shows up to me as one person. If there's more than one person in the room with you, if you're watching this as a pair or a group, would you please type into chat a head count of how many people are with you? If it's just you, that's okay, but if it's more than one person, I'd like to know that so we can keep some kind of accurate numbers for our reporting. And I'll give you a minute to go, oh, wait a minute, I didn't know I'd have to do something, and find your chat box, which should be on the right-hand side of your screen. And you can just type that in. Also, if you have questions or concerns during this, I have everybody muted, so the chat box is the place to put those during the course of this webinar. Okay, with that being said, I will hand the microphone over, and we'll get started. Thank you.
Hi everybody, this is Leila Schlenker. I'm the training coordinator at the Family Planning Council of Iowa, located here in Des Moines. And today we are going to talk about what it's like to visit a Title X clinic, family planning clinic. The items that we'll cover, we'll talk about what exactly is Title X, and by the way, it is Title X and not Title X, like some people have said. We also will talk about the requirements and what that means for clients. The IFPN is the Iowa Family Planning Network. That's a special Medicaid waiver that's available to low-income men and women, and what to expect in the clinic visit itself. So, Title X is the National Family Planning Program, and it was established in 1970 under President Nixon. It was the federal government's response for the need for family planning services. It helps millions of women and men every year to plan their family, to take care of their reproductive health, and to prevent unintended pregnancies, and also to cover well woman health care. It is the only program of its kind, and it does operate under very specific requirements, and we will talk about some of those. So the funding channel, Congress, first of all, appropriates the funds annually. And by the way, I will share with you that this year we are struggling, as everybody is. We are losing funding, and I guess that's just everybody is, so I'm not going to bemoan that much longer. So we start with the U.S. Department of Health and Human Services, go through all these offices of public health and sciences, population affairs, family planning, down to the one of 10 federal regions. We are Region 7. Our regional office is located in Kansas City, and the states covered by Region 7 are Missouri, Nebraska, Iowa, and Kansas. And then from there, it comes to the grantees, and in Iowa we have two Title X grantees, the Family Planning Council of Iowa and the Iowa Department of Public Health. And then we, the grantees, we don't provide direct services. We oversee we're an oversight agency, and we actually subcontract with the agencies that provide direct services. Title X is the only federally funded program that's devoted to family planning. It's designed to provide access to contraceptive services and other reproductive health services, especially to low-income well, to anybody who wants them, but by law, low-income persons are given priority. One of the reasons why the program was enacted in the first place was because unintended pregnancy and its consequences, either an abortion or an unplanned birth, tend to be highly concentrated in the economically disadvantaged population. So as I mentioned in the previous slide, Iowa has 2 grantees, the Family Planning Council of Iowa, and we have 6 delegate agencies, and they are located in the places that you see on your screen: Central Iowa Family Planning in Marshalltown, Edgerton Women's Health Care in Davenport, Hillcrest Family Services in Dubuque, Planned Parenthood of the Heartland in Des Moines, Trinity Muscatine in Muscatine, and Women's Health Services in Clinton. Now, between these 6 delegate agencies, there are actually 26 clinic sites. I believe now it's 25. I think we just had a clinic closing just yesterday that we were informed of. So they cover approximately half of Iowa's counties with services, as they all have satellite clinics. And then the other entity in Iowa that receives the Title X funds is the Iowa Department of Public Health. They have 9 delegate agencies with 40 satellite clinic sites, and they cover the other half, approximately the other half of Iowa's counties. And then they are listed here: Allen Memorial Hospital in Waterloo, Community Opportunities, which I think is now actually called New Opportunities, in Carroll, Crawford County Public Health in Denison, Murchue Medical Center in Harlan, North Iowa Community Action in Mason City, Northeast Iowa Community Action in Decorah, Southern Iowa Family Planning in Ottumwa, St. Luke's Family Health Center in Cedar Rapids, and then the Visiting Nurses in Des Moines. So as you can see, between the Iowa Department of Public Health and the Family Planning Council of Iowa, the state of Iowa is pretty well covered for services. So what kind of impact has Title X had? Excuse me. In 2008, Title X enabled women to avoid about 973,000 unintended pregnancies, and half of which probably have resulted in abortion. Nationally, for every dollar spent to provide services in a publicly funded family planning clinic, approximately $4 are saved in Medicaid expenses on births that are averted. Now, the University of Iowa did a similar study here in Iowa and found that for every dollar spent on publicly funded family planning clinics in Iowa, it saves about $3.78. Excuse me. These savings come from money saved on prenatal care, delivery, and care of a child up to age 1. So this formula does not include the money spent on long-term Medicaid care for a child or children with special health care needs. In 2010, in Iowa, there are over 75,000 people served through Title X. 71,000 plus were women, and almost 4,000 were men. People with incomes at or below 250% of poverty, that was almost 60,000 of those people were served. Excuse me. There are about 4,000 cervical cancer screenings with about a 16% abnormal finding. This is what the Pap smear, most of you are probably familiar with the Pap smear. That's what cervical cancer screening, that's what the Pap smear is for. 80,000 plus STD tests performed, and over 7,000 HIV tests performed. And by the way, just so you understand that the poverty level, and we follow the federal poverty guidelines, 100% of poverty level is $10,400 annual income for one individual. So Title X uses a sliding fee scale that looks at annual income and family size to determine where a client will be placed as far as what payment method. Some of the requirements of Title X include services must be confidential. So what this means, you cannot, a person who works in a Title X clinic cannot even admit that someone has been to a clinic if anyone asks. It doesn't matter if their mother, father, sister, brother, aunt, uncle, or best friend asks. Even if a person calls and says, you know, I know my niece had an appointment there. I just don't remember what time because I was supposed to meet her afterwards. We were going to go have lunch or whatever. Well, most likely they'll hear something like, if the individual you're asking about did have an appointment, I would not be at liberty to discuss that. I mean, they're not going to admit that the person was there. They're not going to admit that the person wasn't there. Voluntary means that a person cannot be required to receive family planning services, for example, in order to receive other types of services such as welfare or job training. You know, if you're in like a publicly funded job training program, you cannot be told, we won't allow you to do this until we have evidence that you're getting family planning. And so you go to the family planning, well, in the family planning clinic, they will not, make you have any kind of birth control that you don't want. The employees of Title X clinics also are informed that they themselves can be subject to prosecution under federal law if they coerce or attempt to coerce any person to undergo an abortion or a sterilization procedure. And finally, the Title X funds cannot be used to pay for abortion. Also, another requirement which is very important is that you cannot deny services or vary the quality of service based on inability to pay. So if a person can't pay, they still can get services. And if you, I'll give you an example of what it means on how, you're not allowed to vary the quality of service. Well, let's say your clinic provides IUDs, and we know that IUDs are expensive to purchase, so you're saying, okay, well, we're only going to provide IUDs for the women who can pay full price for them. Well, you can't do that. If you're providing IUDs for one group of clients, you have to make them available for everybody. Now, what you can do is not provide IUDs, as long as you have a full variety of other reliable methods of contraception. And all Title X family planning clinics must provide interpretive services. Most of the clinics do have bilingual staff in Spanish. For other languages, they will use the language line, and this does include sign language. Not the language line, obviously, but they will have interpretive services. They will find interpretive services for people who are hard of hearing. So, Title X, again, another requirement is that individuals are charged based on their ability to pay. So first, the client's income is assessed. Then there's a sliding fee scale that's, again, based on the federal poverty level guidelines. And then the charges are determined on a schedule of discounts. And even if a client is on the Medicaid waiver, which I will be talking about next, that client still must be placed on the sliding fee scale for items that are Title X services, but that may not be covered by the waiver. And as far as collections, if the client has private insurance, then that will be the first payer to be billed. Then they will bill Medicaid, or again, this Medicaid waiver or IFPN. And then clients who are on a sliding fee scale who don't pay the full amount will be asked for a free will donation, but they will not be in any way coerced or made to feel guilty if they don't, if they feel that they cannot provide a donation. So just to give you a quick idea of how clients are charged, if they're below 100% of poverty, the services are free. If they're between 101 and 250% of poverty, they're put on a sliding fee scale, and if they're at 251% of poverty or above, it's full fee. And then you might see a statement there that says income level of confidential minors determined on their income only, not parents' income. What this means, because everybody's confidential, everybody's a confidential client. But in the case of minors, because Iowa law does not require parents to be notified or give consent for minors getting contraceptive services or STD testing or treatment or so on. So the parents do not have to be notified, and in some cases the minor will say, I can't let my parents know that I'm here, you know, you can't send a bill to my house. Those people, those young minors, are, their income is, you know, income is determined just on their own. And if they don't have a job, then obviously they're going to get the services for free. However, if they come in with a parent, or if they're saying, you know, you can bill my parents' insurance or whatever, then the income is based on the parent's income. So you've heard me talk about the Iowa Family Planning Network already a couple of times, and now I'm going to go into it in more detail, talk about what it is, who can apply for it, how the application process takes place, what's needed, what it provides, how long it gets to be approved, and where people can go to get services that are covered by the IFPN. IFPN is a state-funded program to provide family planning services only to those who don't qualify for Title 19. So it's kind of a safety net for the people that basically aren't poor enough for Title 19 but are not making enough to or have no family planning coverage. The services are free and confidential to those who qualify. And right now the waiver program will end on December 31st of 2013 unless it gets extended, and we hope it will. So any man or woman between the age of 12 to 54 can apply for the waiver, must be an Iowa resident, must be a U.S. citizen or qualified immigrant. Men and women who meet the income limits and other requirements, of course, because it's a federal program, there may be other requirements that apply. Applications can be taken at family planning clinics or at local DHS offices, and a completed application can be submitted in person or by mail to either the family planning clinic or the DHS office. Items that are needed to apply would be proof of citizenship, use a passport or a birth certificate or naturalization papers. Non-U.S. citizens need immigration documents, need a government-issued photo ID, again, driver's license or passport would qualify for that, social security number, proof of income from the past 30 days, pay stubs, statement from your employer, and if there's a court order for child support received. Now, you can still apply even if you don't have these documents, but approval will be pending. It's possible you might be approved the same day if you come in with all your documents and all your ducks in a row, so to speak. Undocumented individuals cannot receive IFPN services. They cannot receive this Medicaid waiver, but they still can receive services and be covered by the Title X sliding fee scale. The services are still confidential and they will not be reported. The services covered include birth control supplies, physical exams, the cancer screening for cervical and breast cancer, STD testing and treatment, pregnancy testing and referral, emergency contraception, and even voluntary sterilization at the clinics that offer that service. As I mentioned earlier, if you have all the documents that you need, your ID, your social security number, your proof of citizenship, and income, then you might possibly be approved the same day at the family planning clinic. At DHS, it will take at least up to 30 days, or it can't take that long. Places where a person can go for services, really are any participating family planning provider that's enrolled with Medicaid can provide the IFBN services, and that includes family planning clinics, private physicians, federally qualified health centers, rural health centers, and are probably the most common places. I will pause here as Becky is coming to take the headphone, and I will also ask you if you have any questions or comments on anything you've heard thus far. Oh, where is anyone else's audio cutting out? Oh, whoops.
Okay. Hi, everyone. I'm Becky Parrish. I'm the Clinical Policy Coordinator. I am the nurse practitioner in our office. So I will be talking about what to expect at the clinic visit. Most Title X family planning clinics are actually the exams and services are provided by a nurse practitioner or physician's assistant. They normally don't have a physician on staff to see patients, but they do have a physician that's a consultant as a medical director and oversees the nurse practitioners and physician assistants. And they also write and oversee the medical or clinical policies that the clinic goes by. Most of the nurse practitioners and PAs, when I refer to a clinician or a provider, that's what I'm talking about, is an NP or a PA. They do have nurses, nursing assistants, medical assistants, and those folks are typically the ones that do a lot of the education as far as safe sex, birth control options, pregnancy testing, and many of the other services that are provided. And they are all very experienced with family planning, and a lot of them have worked there for years and years. Now, one of the things, especially in a preventive exam, they'll want a scheduled appointment, but one of the most important things that they want to get is some history about the patient. So a full medical history would include some of their health, social, sexual, and family history. So health history is the person or the patient's history, their illnesses, conditions like migraines, if they have high blood pressure, diseases like diabetes, if they've had any surgeries in the past, and that would also include any pregnancies and deliveries. Their social history would include smoking, alcohol use, drug use, diet and exercise, or their general health habits. Sexual history would include their gender of the sexual partners that they have, some of their sexual practices. And it's not necessarily because they're nosy, but because they want to get a good idea of any possible problems or risks that might be present or that need to be looked at and evaluated by the clinician. The family history is anybody with cancer, diabetes, high blood pressure, if there's a history of stroke in the family, those kinds of things. Now, as far as the physical exam, some of the things have changed over the years, especially in the last 3 years. The national guidelines have changed. So the physical exam is very dependent on age now. Now, if you go to some of the private practices, OBGYNs, or family practice, they may not be following some of the national guidelines. And they're guidelines, they're not mandatory things, but they are national guidelines that the experts in the field have suggested. So what those changes include are under the age of 21, no pap smear or pelvic is indicated unless there's a problem to do a pelvic exam. A pap, and a lot of women get this confused. They think any pelvic exam is a pap smear, and actually the pap is the cancer screening. The pelvic exam is the speculum exam where they look inside and they insert the fingers to feel inside. So now, under the age of 21, no pelvic or pap is recommended at all. We have a much better understanding of what causes cervical cancer, the progression of it, and how to prevent it. So, and we know that HPV is a big culprit for the causing the cancer. And a lot of times, probably 80% of the time, we know that women or girls under the age of 21 have been exposed to the HPV, but their immune system is strong enough that it fights it off. So a lot of times we were causing more harm than good. So that's why they're recommending not to do a PAP under the age of 21. Now, age 21 to 29, it's recommended to have a PAP every 2 to 3 years. Age 30 and over, every 3 years for PAP, and age 19 to start doing breast exams, age 25 and younger to do STD screening at least yearly, and that mainly is concerned with gonorrhea and chlamydia because we see so much of that. Over the age of 25, STD screening is recommended as needed. So if there's a new partner in the last year, or if they think their partner has had a new partner in the last year, or if they're having symptoms, definitely STD screening can be done anytime there might be symptoms or problems. So for family planning, of course, the priority of all Title X clinics are the family planning aspect. So a lot of what goes into reproductive life plan is discussing what are their plans for having children? When would they like to start having children? Do they have plans to go to college? Do they want to have a job, career? Those kinds of things. And if they already have children, are they thinking about how they want to space their children? Do they want 2 or 3 years in between having children? Do they want to have them close together so they can get it done now the way? You know, what are their goals and life plans? And that will then determine or help determine what their contraceptive needs are. The LARC methods we've talked about in the past, and those are the long-acting reversible contraceptives, which includes the IUDs and the Implanon or implant, which is now called the Nexplanon. It also includes the hormonal methods, such as birth control pills, patch, ring, depot shot, and the barrier methods, condoms, the male and female condom, as well as the diaphragm. So their reproductive life plan will help the clinician and the patient determine what kind of contraceptive needs that they might have and what method is best for them. Other services that are provided include some of the preventive services, such as pregnancy testing and cervical cancer vaccinations. Now, for example, with the pregnancy testing, if it's positive, counseling and discussion about possible options would be offered. For example, if they plan to continue the pregnancy and parent their child, or if they know that they want to continue the pregnancy but they are not ready to raise the child, fostering or adoption might be an option. Or the last option would be a termination of the pregnancy, such as an abortion. They can give them information about any one of those options if they're interested in those. Now, if they want to continue their pregnancy, the clinics can also help them find a physician to help them throughout the pregnancy, to do OB care and also for delivery, and give them information about Title X if they might qualify for that, get them started on prenatal vitamins. And some of the agencies also do prenatal care so they can continue to see them throughout their pregnancy. If the pregnancy test is negative, then they want to discuss, well, are you on a birth control method? Do you want a birth control method? If you're not wanting to get pregnant, then we need to find a good method of birth control for them and give them the options for that. Now, the cervical cancer vaccinations, I think we've talked about in the past. Those include Gardasil and Cervarix. Gardasil is the first one that came out. It is indicated for boys and girls aged 9 to 26, and that covers 4 of the types of HPV subtypes. The Cervarix only covers 2, so is mainly for cervical cancer prevention, and that's for girls ages 10 to 25. Now, the other thing that the family planning clinics will offer is evaluation and treatment of some other conditions. So those things would include vaginal infections such as BV, bacterial vaginosis, or yeast infections, urinary tract infections, STDs such as gonorrhea, chlamydia, trich, and herpes testing, and also HIV testing and referral if necessary. The treatment of genital warts, the evaluation and possible treatment of any menstrual problems. For example, if they're not having any periods at all, or if they're having frequent periods or heavy periods or painful periods. Another condition is called polycystic ovarian syndrome, and that's a condition that can cause very infrequent or irregular menstrual cycles, excessive hair growth, insulin resistance, obesity, and possible infertility. And also they can provide some basic infertility workup, which would include STD screening, menstrual cycle evaluation, discussion of ovulation prediction, and the timing of sex according to their ovulation prediction. So those are some of the basic services that are also offered by Title X clinics. Now, if an STD test does come back positive, the clinic normally is the one to notify the patient and offer treatment. What they'll do is they'll usually call the client and let her know that she has a positive test and instruct her to come into the clinic for treatment. They will also let her know that her partner needs to be notified, because if he's not treated, then she could easily get the infection again. Now, most of the STDs are notifiable diseases. Gonorrhea, chlamydia, syphilis, and HIV are what I mean by most. The ones that are not notifiable diseases are HPV and the herpes, or the human papillomavirus, which causes cervical cancer. That's not a reportable disease. And also herpes, HSV infections are not notifiable diseases. So in the case of gonorrhea, chlamydia, syphilis, and HIV, the disease prevention specialists will get involved, and those are the ones that are through the Iowa Department of Public Health, and they will coordinate with the clinic to make sure that the patient has been notified and treated. And especially for gonorrhea, syphilis, and HIV, they will get involved as well to notify or make sure that the partners are treated. Now, this can be a concerning situation for some clients, because especially if she's in an abusive relationship, she may not want to notify her partner personally. She can ask that the clinic or the DPS person can notify the partner. And what happens in that situation is, for example, the DPS, the disease prevention specialist, they can notify her partner, and it'll be all anonymous. And what that means is they will tell the partner that they have been named as a contact in the last 6 months. They will not give the contact's name, and they will instruct the partner to seek a Title X clinic or their own physician or clinic, family planning or family practice clinic, so that he can get tested and treated. Now, most of the Title X family planning clinics do prefer scheduled appointments, but they don't make it mandatory necessarily. They can do some services on a walk-in basis. Depending on the clinic, if they have a clinician available, depends on their situation, but they do accept some walk-in patients. The limited services that would be provided could be urinary tract infection testing, pregnancy testing, emergency contraception provision, birth control, supply pickup or Depo-Provera injections. Some of the clinics also do provide birth control or prescriptive birth control methods without actually seeing a nurse practitioner or PA. For example, some of the Planned Parenthood clinics in the state, they have standing orders. So if you see a nurse, that nurse can consult with a clinician over the phone and then get that patient started on a birth control method without seeing the clinician. The Title X clinics do see patients that are undocumented, that are not U.S. citizens. Now, those patients would not qualify for the IFPN, as Leila mentioned, but they would qualify for Title X services. The other thing are the adolescent patients. They definitely qualify for services without parental consent. So no consent is needed from an adolescent parent. And like Leila said, Title X funding does not cover abortions at all. Now, Title X clinics, they act as a pharmacy. So they have their own pharmacy per se in their clinic. And most of the contraceptive needs, antibiotics for treatment of STD and UTIs are provided within the clinic. So those would include birth control pills, patch, ring, IUDs, Implanon, Nexplanon, condoms they usually have, as well as emergency contraception. And then the antibiotics that would treat the sexually transmitted infections and urinary tract infections. Now, some of the ones that they may not have are the more expensive options for birth control, such as the ring or the patch. They may refer that somewhere else. They may not carry it, so they may write a prescription and have the patient pick that up at the local pharmacy. Another thing would be, for example, the treatment of herpes. So they usually don't have those medicines available, but they can certainly write a prescription for those, and they can be picked up at the pharmacy. So at this point, I am finished with that part of the webinar. So if there's any questions, go ahead and type that in. And we want to remind you that funding was provided from the Laylor Foundation to provide these webinars. And the SurveyMonkey will go out from Kirsten as far as the webinar and the follow-up, and then she will make sure that this is downloaded, the recording, for future review. And we're not seeing any questions? Okay, thank you, and I will hand this back over to Kirsten. Okay, we'll just say goodbye. Thanks, have a great day.